guys, my name is Olivia Rabone, and today I'm going to be talking about the nervous system, musculoskeletal, and neurovascular assessments that we're going to be doing, and also the level of consciousness and Glasgow Coma scale. So first I'm going to start off with the nervous system, and of course, with every type of assessment that you're going to be doing, you start off with the subjective assessment, and it's going to be pretty similar for each kind of assessment that you're going to be doing. So you'd want to be asking their history, their medication, the nutritional health they have, their bowel and urinary movements, how much sleep they're getting, if they're having productive sleep, how much they exercise, and also how they're dealing with whatever diagnosis, disease that they are dealing with. And then you would go off to objective assessment, which is going to be different for each one. For the first part of the objective assessment, this is something that you can see with your own eyes. You don't have to do certain tests like for others. You can sort of pick up on their mental status and their general appearance and behavior, their cognition, mood and affect, and all that type of stuff. So that's something that you can clearly see and ask a few questions about. But for the nervous system, a really good objective assessment test to do is the testing of the cranial nerves. And so I'm going to demonstrate that on my assistant here. And so the first one you're going to start off with is Cranial Nerve 1, which tests your sense of smell. So how you do this is, if you would please close your eyes, and I'm going to place this in front of you, and if you could identify the smell.
Cinnamon.
All right, he identifies cinnamon. All right, for Cranial Nerve 2, I'm gonna ask him, Cranial Nerve 2 is to test the being able to see and read something from a certain distance. And so I'm gonna ask him to read off one of the words here. So if you could read off that word.
Sensing.
All right. And then for Cranial Nerve 3, 4, and 6, and a good way to remember them is 3, 4, and 6 make the eyes do tricks. And so how to test these 3 cranial nerves is to have them follow a pen. All right, and so what will you do is I would like for you to follow this with your eyes and don't move your head. All right, and that just checks perla and the ability for the eyes to move symmetrically and all that type of stuff. Now for Cranial Nerve 5, you test the facial sensation and strength. And so how to test the motor part of it is to have them clench their jaw. All right. And then the sensory part of Cranial Nerve 5 is you would have them close their eyes. And then I would ask him to identify if he feels soft or sharp.
Sharp. Soft. Soft. Sharp.
All right, pass with flying colors. All right, and for Cranial Nerve 7, you would have them raise their eyebrows, close your eyes real tight, blow up your cheeks, give me a big old smile, frown, and purse your lips. All right, there you go. That just tests the facial strength as well. Now with Cranial Nerve 8, this is about hearing. And so a good test for this one is to go behind each of their ears and whisper 3 words and have them identify those words back. And so I'm going to go behind your left ear.
Dog, shoes, and dress.
All right, I'm going to do the same thing on his right ear.
Chair, tree, cat.
All right. And a good way to do that is you want to pick 3 words that have no reference to the other one, because sometimes people that have issue with hearing like to compensate for it. And so they would try and guess all that type of stuff. I mean, it is something that they feel insecure about. but this is a good way to do it. So make sure that they're random words. All right, for cranial nerve 9 and 10, and it's also going to be 12 as well, you check the gag reflex and you make them say ah. And with 12, it's also sticking out the tongue. So I'm checking off 3 right here. So if you could open your mouth, stick out your tongue and say ah. All right, there we go. And then for cranial nerve 11, a good way to test this is put your hands on their shoulders and have them shrug up and then shrug down. All right, and then I would put my hand on the right side and have him lean to the right. All right, and then lean to the left. All right, that just tests his ability of strength. And so that's for the nervous system assessment. Now for the musculoskeletal assessment, it's pretty same with the subjective. Like I said, you ask those certain type of questions about medication, health, all that type of stuff. Now with objective, you're testing muscle strength and their ability to do full range of motion without pain or laxity. It's also to identify muscle atrophy and asymmetry. Excuse me. And then you also want to make sure there's no tenderness on palpation. So if someone like just had a broken arm or something like that, and it's just probably been like 3 months, and so you're still checking out the healing process of it, you want to make sure there's not really like tenderness upon palpation and all that type of stuff. And inspection as well. You want to make sure there's no swollen or redness or edema. Now another good way is have them stand up, and you would want to make sure they have a normal spinal curvature. And so if you could turn to your right. A good way to test this is you could bend down a little bit more. Just make sure that they have a normal equal spine, all right? And then another way is to check, make sure they have full range of motion without pain or laxity. So if you could do some normal things. All right, it's just a check for daily active living, just to make sure if they're not having pain, or you can sit down, tenderness upon doing those type of things. Now another way is there's this muscle strength scale, and it's out of 5. And so the best type of score is 5 out of 5. Sorry, I was a little premature telling you to sit down. If you can stand up again and just move the chair a little bit to the left. And it is a heavy chair, I swear. All right, and then you can sit back down. So that just tests muscle strength without hurting himself or overexerting as well. You also want to make sure there's, especially something you would notice with someone with arthritis or any type of fracture, is you want to make sure there's no joint swelling, deformity, or crepitation. And crepitation is basically the crackling of fractured ends, which you would see with arthritis, especially rheumatoid arthritis. So they would be like moving their hands, all that stuff, and you would hear some crepitation, some crackling, because the fractured ends are getting broken down. And so that's the musculoskeletal objective assessment. Now with neurovascular, this is very important to check because this makes sure that there's proper circulation, and it also helps with other pre-existing conditions as well. And so a good way to test it is, the first one would be pain level. And so with pain level, I mean, you can have their verbalness, where you can have them rated on a scale of 1 through 10. 10 being like an intense type of pain that they can't even handle it. And another good indication is nonverbal. And so you'll see this with grimacing in their face, and then guarding. They're not wanting me to touch the place where that is hurting. And then you're also going to see tachycardia, hypertension, hypotension, dyspnea, any type of, nonverbal indication of pain. Now, you're also going to want to check skin integrity, like pallor or cyanosis. Cyanosis could indicate, that not enough oxygen is reaching their cells or skin, and so they could be turning blue. Shiny and pale skin could indicate compartment syndrome. Now, you'll also want to check skin temperature. I mean, the best way to do this, of course, is with a temperature instrument. But I mean, another way is, checking the forehead with your fingers. Because you'd also want to do that. You want to make sure that their, cool skin could indicate arterial supply inadequacy, and warmth could indicate inadequate venous return. Now with pulses, you'd want to check radial, ulnar, brachial. Another good place with the lower extremities are going to be femoral, which you could check right up here. Top leadal is behind the knee. Another good place is, excuse me, Leo, on the top of the foot, and also on the side, if you could move right here, like right here. Those are good places to check pulses. Now, another good way to measure pulse is a scale of 0 through 4. 0 is kind of like an very light, very weak pulse, and 4 is bounding and very strong. So you probably want to be in between those, around like 2 or 3. Now, also another good indicator to do is if you have trouble finding a pulse, it's good to use a mark with like a Sharpie or something like that, so that future nurses and doctors can be able to find it and not spend like 5 minutes trying to find the pulse. You especially see that with the top of the foot. That one's sometimes hard to find at times. Now, you'd also want to check numbness and tingling. A good way to check that is with Cranial Nerve 5 that I showed with the nervous system assessment. You would also want to check edema and swelling. That could also be a pre-existing condition like heart failure, cirrhosis, or kidney disease, but it's always good to make sure there's not an issue with that. And a good way to help with edema and swelling is, you would usually see this if a person is lying down, but you would want to elevate the limb and make sure that it's no higher than the heart level. So like if someone was sitting down, like a good way is to have them sit up like that, but it's better if someone's laying down that you elevate it. Now, another good way to check circulation is have them move their extremities, so like their fingers equally, and then their feet. And the best way with the lower extremities is having them move their toes, but I know he can, so it's okay. And then another really good way is with capillary refill. Now, 2 and below seconds is a pretty normal response to having it go back to normal. So you check it by pressing on the nails. It will make it blanch. And so that's what I mean by having it go back to normal at 2 seconds or less. Now, if it's above like 3 seconds or more that it takes longer to go back to normal, there could be a circulation problem. All right, and so that's a good way to assess neurovascular. Now, the last part that I'm going to be talking about is the level of consciousness and the Glasgow Coma scale. And this just assesses comas and impaired consciousness. And so with the Glasgow Coma scale, it's going to be divided into 3 sections. So you're going to have the eye-opening response, the verbal response, and the motor response. And it's all going to be checking off with numbers. The lower the number, you're going to see someone more like impaired on their level of consciousness or in a coma completely. And so an example of how they rate or check off the numbers is with the eye-opening response. You're going to have spontaneous, where they blink their eyes and it can go back to normal. Or a verbal stimuli is the next one, which would check off 3, is telling them to blink their eyes. And then 2, where you would check that off, where it's slowly getting worse, is where they open their eyes or clench their eyes by pain only stimuli. And then 1, which is the worst response, is having no response at all to opening their eyes or anything like that. And so the verbal response and motor response are pretty similar, with being oriented to no response whatsoever. And so that's a good way to assess level of consciousness. So that is all I have to talk about. Thank you.